Do you think the U.S. life expectancy, on average, compares to other countries, like mostly wealthy countries? Number 1 in the top 5, in the top 10, 20th place, or 31st place?
31st place.
You're right.
I think this B, or the second one we did.
No, top 5? Okay.
I would say 30 and above.
So that is how the US relates to other nations for life expectancy.
Yeah.
What category?
Yeah.
Top 20.
Mostly among the developed nations, so top
Oh,
20.
developed.
Yeah.
Yeah.
Now I'm not sure. The top 10.
Careful, I have gained. Yeah. 10. I have gained.
Do you get to know the answers?
Yeah, so you have top 20, top 10, and top 5
Yeah.
in there. Okay, so the answers actually were 31st place.
Oh, wow.
Yeah. They're about 30.
I would say top 10.
Top 10?
I think it was in top
Let's
5.
play soccer. Let's play baseball.
I would say top 10. Yeah.
Alright, top 5 is actually good. Yeah, so.
Look at you.
Alright.
Kind of depressing.
Yeah.
Lack of progress.
There's been some progress, but more so by the other nations catching up.
What you eat?
What you eat? Okay.
I'm going to go with health insurance.
Okay, health insurance.
Go with smoking.
Hey!
Oh,
Sorry. Speaking of health.
Yeah, you right there?
Well.
Well,
The food you eat?
The food you eat. Good guess, but it's actually no.
Oh my god.
It's whether or not you're wealthy.
where you live?
It's just eating right, I guess.
Mhm. Would you say that's like the biggest one?
Exercising.
Yeah. Okay. Like what makes a person healthy?
Like the food they eat, their social status, just like you guys said, income, like whether they live in a developing country or not, and most importantly, like if they exercise, just yeah.
I would say access to health care and health education. And I know that that's based in part on income and where people live. As we were mentioning about the different counties have a different life expectancy. And I'm from a rural area of eastern Washington, and we have a hard time keeping providers because our average income for the providers is so much lower in the rural areas. And I would love to see more healthcare education happening in our public schools.
Yeah, definitely. Do you notice, like, when you were, like, lived over in Eastern Washington, like, less access to healthcare just because of, like, kind of less dense areas? There's less demand, or?
And people have to go farther.
Further.
We have to go 50 miles for the nearest hospital.
Oh, wow.
And we have a very good first responder EMS program. We have quite a number of paramedics living in our community. And otherwise, we would have a lot more deaths in our area because we're so far from the hospital.
Yeah.
Listen, we should be listening to this, guys. It's pretty interesting stuff.
Never. I don't know how to read yet.
We don't know how to read yet.